nagbibigay ng calcium supplements. Kasi di ba, mababa ang calcium kasi tumataas ang phosphate. Okay. So, next one. Antihypertensives and cardiac medication. Why? Patient will have hypertension and congestive heart failure. Right. Another one, anti-seizure. Ano nga ang meron ng pasyente? They have your encephalopathy. So, therefore, seizure, unconsciousness, changes in the level of sensorium may appear. So, that is why anticonvulsants medication is provided. Okay. Another one, to correct the anemia, okay, one of the therapy to immediately correct, tandaan ha, pag immediate correction ng anemia, blood transfusion. Okay, immediate ang correction. Pero kapag yan ay in several days, kailangan erythropoietin. Ano ba yung synthetic na erythropoietin? The synthetic erythropoietin is your epoetin epogen. Ano ang action niya? Just like your erythropoietin or your hormone, it will stimulate the bone marrow to produce more RBC para makorek natin ang anemia. So tandaan, in the immediate correction of anemia of a patient with renal failure, blood transfusion. To correct it within several days, epoetin epogen. Alright, next one. Diuretics in the early phase. Bakit bawal na tayo on the last phase? Kasi kapag end stage na yan, dialysis would be your resort, okay, to your fluid accumulation. Okay, sodium bicarb, para saan yan? For metabolic acidosis. Topical lotions, naalala ba, bakit tayo nagbibigay ng lotions or super fatted lotion? Because of the presence of pruritus. So, to maintain a good skin integrity. Antihistamine, bakit nagbibigay ng antihistamine? Because of your uremic frost that causes your pruritus. And also, high biologic value protein. Tandaan, ang diet natin, low protein. Bakit nga ulit low protein? Kasi nako-convert ang protein na kinain ng pasyente into ammonia. Ammonia will be converted by the liver into urea for excretion. So, ang problem natin, the end product is BUN or your urea. So, therefore, ang diet ay low protein. Pero, tandaan, yung protein na ipoprovide mo, low protein siya. Pero kailangan high biologic value. Anong ibig sabihin ng high biologic value? It comes from animal sources. So, what are those? Example would be your dairy products, eggs, and meats. They are of high biologic value. Okay? Kasi kailangan din nila ng protein to maintain the oncotic regulation. Alright, next one. Limit fluid intake. Bakit nga? Kasi diba, they have now pulmonary congestion. They also have your edema and ascites. You also have congestion of organs such as the heart. So the fluid intake, ilan nga pag limiting fluid intake? 1.5 liters only per day. Naalala yan? So, bakit kailangan 1.5? To prevent further accumulation of fluid. Alright. And of course, the other diet of the patient should be high caloric and high fat because of the presence of fatigue and weakness. Right? So, they are your management for a patient with renal failure. Right? So, they are your most important genitourinary conditions for the patient. Alright, let's continue our discussion with musculoskeletal disorders. In musculoskeletal disorders, we will be comparing three types of arthritis. No? So we will be discussing gouty arthritis, osteoarthritis, and your rheumatoid arthritis. Alright, first, let's talk about your gout or your gouty arthritis. Okay, when we talk about the gout, the main problem here is your increase in uric acid level. Na ba? So, ang pinaka-problema po natin kung bakit nagkakaroon ng gout is an increase in uric acid level in the blood that causes its deposition to your joints. Okay? So, usually this is one of the common joint disorder, second to your osteoarthritis. Now, what are the possible causes kung bakit tumataas ang ating level ng uric acid? Alright? So, let's talk about your causations. Okay, so we have what we call the primary and secondary causes kung bakit tumataas. Number one, it could be from family history. Pag sinabi nating family history, that is genetics or hereditary. Second, severe dieting or starvation. Bakit pag tayo ay nagda-diet or nagsa-starve ng sarili? Why? Because when we are having your starvation, nabe-breakdown yung own protein ng ating body. And tandaan natin, one of the waste product pag na-breakdown ang protein is uric acid. So that is why tumataas ang uric acid in the level of uric acid is increasing in the blood. Alright, what else? Isa sa pinaka-importante would be the diet of the patient. Ano ang diet ng pasyente? The diet are high in purine. Saan natin matatagpuan yung mga diet that is high in purine? Next slide tayo. Okay, so these are the diet that is rich in purine. Ano po? It could be found on anchovies, di ba? What else? Sardines. It could also be found on your mushrooms, okay? It could also be found on other substances, gravies, sauces, what else? Aside from that, alcohol, and pinaka-importante is your meat. Okay, tandaan natin, it is your organ meat. So, pag tinanong, alin dito sa mga pagkain ang nagkukos para tumaas ang uric acid, you need to remember your organ meats. Yung mga liver, di ba? You have also your kidneys. Okay, so yun ang mga rich source ng ating purine. Okay, now, what are the secondary causes? Secondary causes po tayo. Now, secondary is your increase in cell turnover and increase in cell breakdown. One of the best example here is in a cancer patient, nagkakaroon tayo ng tinatawag nating tumor lysis syndrome. Naalala ang tumor lysis syndrome? It is a complication of your chemotherapy and a rapid destruction, rapid necrosis of your cancer cells can lead to increase in uric acid level. So, possible din po pala na as a secondary cause, by means of treatment, ay tumataas din ang uric acid level. Now, what are the clinical manifestations related po sa ating patients with gouty arthritis? So, these are the earliest sign. Tandaan, you have your pain. Okay, bakit nagkaroon tayo ng pain? Dito tayo ha. Ito yung area kung saan na-deposit yung uric acid. So therefore, kung may uric acid dyan, the primary is your inflammation. Tandaan, pag may inflammation, may swelling. Swelling of the area will cause what? It will cause stretching of the tissues. And when the tissues are being stretched, prostaglandin will be produced. Diba? By means of that prostaglandin, that is the reason why the patient has severe pain. Okay? So another manifestation of inflammation aside from swelling and pain is the loss of function. Anong ibig sabihin ng loss of function? Tandaan, pag masakit, hindi maigalaw. So therefore, may hirapan ng pasyente to ambulate. Okay? And of course, redness and warmth could be noted because redness and warmth is also a sign of manifestation. Tandaan, kapag sinabi natin yan ay gouty arthritis, ano ang kanyang pagkakaiba sa ibang type of arthritis? It is abrupt in onset, biglaan, and usually the pain aggravates at night. Pinakamasakit kailan? Tuwing gabi. Alright, what else? In the laboratory studies, mataas ang uric acid level. Alright? So, ano ba yung normal na uric acid level? Diba, the normal is 8 to 20 mg per dl. So, therefore, pag mataas ng 20, that is a sign of what? Of your increase in uric acid. At anong complication natin? Ang complication natin would be your tophi formation. Anong nangyayari kapag tophi formation? There is joint enlargement. Tingnan natin dun sa first slide natin on gouty arthritis. Okay, ano yung tinatawag nating tophi formation? Yes, okay. Ito yung tinatawag nating enlargement of the joint because nagkakaroon na tayo ng mga deposition ng uric acid. Alright? So, this is what we call tophi formation. And another danger, not only it is dangerous for the joints, but it could also be fatal on the patient's kidneys. Ano po? Okay, so in the clinical manifestation, okay, makikita nyo, kasama din dyan ang kidney stones. Why? Because uric acid or your increase in purine diet could be a risk factor in the development of urinary calculi. So, dalawa yan. Pag sinabing gout, pwede yan mag-deposit sa joints. It could also be deposited into the kidneys. Alright. Now, what are your management? Collaborative management kapag may gouty arthritis. Okay. Tandaan, ano ang priority natin? The priority for arthritis is pain. comfort would be your priority. That is the best reason why do you have to administer your NSAIDs. Tandaan ha, pag sinabi nating NSAIDs, it stands for non-steroidal anti-inflammatory drugs. Okay? So that is your non-steroidal anti-inflammatory drugs. Okay? Now, tandaan po natin, when you are giving NSAIDs, please remember that you need to administer NSAIDs with food or with meals. Bakit kailangan with meals ang NSAIDs? Kasi ang NSAIDs po natin, nagkakos yan ng ano? It could cause what? It could cause gastric irritation. Diba? Kasi na-activate niya yung ating gastric acid para tumaas. So therefore, NSAIDs should be given with food. In addition, ano po, kapag prolonged ang use ng NSAIDs, tandaan po natin that NSAIDs could also cause hepatotoxicity. Alright, another one. You have also your colchicine. Okay, colchicine is also drug for pain. Okay, para sa pain din yan. Ano naman ang ginagawa ng ating colchicine? Alright, the action of colchicine is that it inhibits your leukocytes that could be found on the synovium. Ano ba yung leukocytes? Diba ito yung mga WBCs or the inflammatory mediators. So therefore, ang gagawin po natin dyan, pag nawala or na-inhibit yung WBC or yung leukocytes, ano ngayon ang mangyayari? Mawawala yung inflammation. Pag nawala ang inflammation, wala ang swelling. Pag wala ang swelling, mawawala din yung pain. Alright? So that is the action of your colchicine. Third, you have your corticosteroids. Okay, now what is the action of corticosteroids? Corticosteroids is anti-inflammatory. So again, it reduces the inflammation to prevent swelling and pain. Now, ang tatandaan po natin is the nursing consideration with regards to the use of corticosteroids. Alright? So, tandaan, corticosteroids should also be taken with meals because it causes gastric irritation. How about the important side effect of corticosteroids? Important side effect, it could cause gastric ulcer, kaya nga it is taken with meal. It could cause edema and weight gain, so you have to check the weight and to minimize the intake of your fluid and minimize the intake of sodium-rich food. Diba? And in addition, tandaan, do not abruptly stop taking steroids. Kailangan steroids should be what? Steroids should be tapered. Pag sinabi nating tapered, dahan-dahan na i-reduce ang dosage. Hindi natin dapat itigil ang steroids immediately because we have to wait first for the natural action of the adrenal gland, which is responsible in the secretion of the natural steroids. Alright. Fourth line of the drug. Pang-apat is your probenecid. Ano ang classification ng probenecid? Probenecid is a urocosuric drug. Alright, anong ibig sabihin ng urocosuric drug? Pampaihi ng uric acid. So, ang ating action of probenecid is it promotes the excretion of uric acid into the urine. Thus, it prevents your uric acid formation in the joints and in the kidneys, prevention of gouty arthritis, and prevention of your urinary calculi. Last but not the least, the main drug of choice that you have to remember is the xanthine oxidase inhibitor known as allopurinol. Ano po ba yung xanthine oxidase? Xanthine oxidase is an enzyme that is responsible in the conversion of purine to uric acid. So therefore, pag na-inhibit mo yung xanthine oxidase, mapo-form pa ba ang uric acid? No, it will not be formed. So this drug is to prevent the metabolism of purine to uric acid. Thus, it will lower the level of uric acid, which is the main cause of your arthritis. Alright, so they are your drugs. How about your nursing management? Your priority is to promote comfort. What are the measures to promote comfort? Diba? Sabi natin, non-pharmacologic relief, such as warm soaks, diba? Another one is your warm compress that could also relieve the pain. Another one, sabi natin, ang iniiwasan natin is the formation of your uric acid. Or yun yung parang may iwasan natin yung crystallization. Now, how can we prevent the crystallization of uric acid in the joints and in the kidneys? Thus, we need to have your increased oral fluid intake. Okay? So, kasama dyan, tandaan, increased oral fluid intake. Another one, kasama din, tandaan, obesity is another risk factor in the development of your gouty arthritis. So therefore, ano po ang gagawin natin? You need to instruct the client, teach the client how to lose weight. Because losing weight will also relieve the joints, the stress from the joints, as well as it prevent further increase in uric acid formation. And of course, you need also to teach the client how to prevent, okay, or how to avoid yung mga foods that is rich in purine. What are the purine-rich foods na nakakapagpataas ng uric acid? Diniscuss natin kanina. Example would be your organ meats. Primarily po yan. What else? Aside from organ meats, kasama din ang sardines, anchovies, di ba? Naalala yon? Diniscuss din po natin, alcohol intake, kailangang i-lower din po natin, di ba? Another one, na mga contents na mataas sa purine, kasama din ang mga gravies and sauces. Sweet breads, di ba, are also high in purine. So those foods should be avoided. And thus, kapag na-control natin ang uric acid level, we are going to eliminate the manifestations of gouty arthritis. Right? So that is all about your gouty arthritis. Alright, let us continue with osteoarthritis. Let us try to compare. When we talk about osteoarthritis, it is the most common degenerative condition of the joint. Okay, it is the most common degenerative condition of the joint which typically occurs in elderly patients, usually male. Tanda na, ng pinagkaiba niya kay rheumatoid. Pag osteoarthritis, it affects usually the male population, elderly clients are involved. Now, what are the possible causations and risk factors to this? Saan po nanggaling yan? Okay. Next slide, please. Alright. Risk factors includes the following. Okay, so you have your family history. It has a familial tendency, hereditary. Sabi ko kanina, kanino common? This is common in older adult, elderly, more than 60-year-old. Okay, tandaan niya na, more than 60. Usually, men. Okay, pinagkaiba niya kay rheumatoid. Pag rheumatoid, female yan. So, pag sinabi nating osteoarthritis, it's common on male population. Another risk factor, obesity. Do you remember President Arap? Diba? Kay President Arap, okay, yun ang common na kanyang sakit. Okay, kasi sabi natin, common ito sa older population, and at the same time, okay, kapag ang patient po natin ay mataas ang body mass index or there is obesity. Alright, what else? Aside from that, it could also be a hormonal factor, a mechanical injury. Ano yung mechanical injury? Example would be your overuse of the joints. Yung mga runner, yung mga always using yung ating mga weight-bearing joints. And of course, previous joint damage would also be another risk factor. Alright, now, when these risk factors is present, what will be the result? It results to the release of your cytokines by your chondrocyte. Ano ba yung chondrocyte? Chondro, it means your cartilage, diba? Chondro is cartilage. Cyte means cell. It is the cell of the cartilage that releases the cytokines. Ano bang ginagawa ng cytokines? Cytokines is an inflammatory mediator. O, pag sinabi nating inflammatory, nagkakaroon na naman tayo ng manifestations of inflammation. Alright? So, ano nangyayari pag may inflammation? Naalala ba, pag merong inflammation, nagkakaroon tayo ng mataas ang leukocytes, tumataas ang mga inflammatory mediators, proteolytic enzymes. So, ano yung proteolytic enzyme? Proteo, protein, lytic means destruction. So, destruction of protein in the cartilage would occur. Metalloproteases and your collagenases, which results in the destruction of the joint. So, anong mangyayari whenever there is inflammation? Alala yung pagkakasunod, whenever there is inflammation, there is swelling. You remember? Kapag may swelling, anong next sa swelling? Nangyayari, there is, sabi natin, stretching of the tissues that leads to the production of prostaglandins. So, ano nangyayari? There is pain. Kapag may pain, ano nangyayari sa pain? There is what we call loss of function. Nahihirapan tayo in ambulation and performance of ADLs. And of course, patient will manifest redness of the area and warmth of the affected area. Now, these are the stages of your osteoarthritis whenever there is joint damage. Alright, next slide please. Alright, so How does osteoarthritis occur? First, nagkakaroon muna tayo ng destruction or inflammation. After the inflammation, the cartilage will have the thinning. Bones and cartilage will become thinner, and that's the time that there would be destruction of the whole cartilage. Now, when the cartilage has been destroyed, that's the time nagkakaroon tayo ng disability. Okay? So, they are what we call your osteoarthritis manifestations. Okay? Now, what are the signs and symptoms? Sige, next slide please tayo. Signs and symptoms. Okay, tandaan po natin. Usually, when we talk about osteoarthritis, the common joints that is involved are the weight-bearing joints. Tandaan na? Okay, ano yung mga weight-bearing joints natin? Tandaan, it occurs on the hips, knees, spine, cervical, and lumbar. So, tandaan po natin ha, okay? It is on the hips, the knees, and the spine is affected. Why? Because usually it affects the weight-bearing joints. Ano ang pinagkaiba natin kay rheumatoid? Tandaan, ang affectation is unilateral and localized. What do you mean by unilateral? It is only occurring at one side of the body. Localized, ibig sabihin, it only involved the local tissue which is the weight-bearing joint. Unlike your rheumatoid, pag rheumatoid, buong katawan yan, bilateral. Pag sinabing bilateral, kung anong meron sa kanan, meron din sa kaliwa. So ang ating osteoarthritis, isang side lamang ang affectation. Okay? Localized, ibig sabihin po, it does not involve the whole system of the patient. It does only involve yung ating weight-bearing joints. So primarily, tandaan, what are the weight-bearing joints? You have the hips, knees, and your spine could be affected. Alright, so clinical manifestations, signs and symptoms of swelling, diniscuss natin yan. You have your pain. And the usual characteristic of pain is it is highly relieved by rest. Okay? So tanda na, pag tinanong which one characterized your osteoarthritis, it is the pain that is highly relieved by rest. What else aside from that? Kasama din po dyan ang tinatawag po nating morning stiffness. Naalala, di ba? Pag may pain, may loss of function. So, hindi igagalaw ng pasyente ang certain joints for a long period of time. So, kung hindi niya iginagalaw for that long period of time, stiffness will occur in the morning. So, that is the best reason kung bakit nagkakaroon tayo ng stiffness. And, tandaan, may or may not involve the finger joints. Pwedeng hindi kasama, pero sabi natin, it is most commonly affectation po natin is your weight-bearing joints. And of course, you have also what we call a painless bony nodes that would appear. You have what we call your Bouchard's nodes and your Heberden's nodes. Alright, ano ba ang pagkakaiba ng Bouchard's at saka ng Heberden's nodes? Okay, pag sinabi po nating Heberden's nodes, it is located in the ito po ay nasa distal interphalangeal joint. Okay? Distal interphalangeal joint. What do you mean by distal? Pag sinabing distal, distant area. So for example, ito yung patient. Okay? This is the patient's anatomical position. So distal, nandito, yung mas malayo. So, yun yung tinatawag nating Heberden's node. Okay? So, again, anong affectation? The affectation in Heberden's node is your distal interphalangeal joint. Alright, next one. How about your tinatawag naman po nating Bouchard's node? When we talk about your Bouchard's nodes, it affects now your proximal interphalangeal joint. Nasa naman yung proximal? Yung malapit sa patient. So, in this case, this is your proximal interphalangeal joint. Alright? So, these are one of the clinical features that could be present on a patient with osteoarthritis. Alright? So, again, pain that is highly relieved by rest with morning stiffness that affects your, ano nga naapektuhan? Weight-bearing joints, hips, knees, and spine. Fingers may or may not be involved. It is unilateral and localized in nature. Alright. Now, how can we diagnose? Paano natin makikita that the patient is suffering from your osteoarthritis? In osteoarthritis, one of the diagnostic procedure is your x-ray. So, in x-ray, in here, ito yung makikita mo, this is the normal cartilage and the normal joint. Ayan. How about in a patient with osteoarthritis. As you can see in this structure, they have a narrowing of the joint space and the presence of osteophytes. Ano yung tinatawag nating osteophytes? Osteophytes is the presence of your spurs. These are the spurs. Alright? So again, in the x-ray, it will be detected narrowing of the joint space and presence of your joint spurs. Anong tawag natin doon? That would be your osteophytes. Alright. Now, what are the management? Medical surgical management. Alright. So you have your management. The priority again for osteoarthritis is pain. So you have to provide comfort. So again, NSAIDs such as acetaminophen. Now, NSAIDs, non-steroidal anti-inflammatory drugs. Ano nga ang side effect natin dito? One of the side effect is it causes gastric irritation. So therefore, kung ito ay nagkakos ng gastric irritation, when is the best time to administer the drug? The drug is best taken with meals, diba? To prevent gastric irritation, to prevent gastric ulceration. What else? Aside from that, COX-2 inhibitor, cyclooxygenase 2 inhibitor. Alright, bakit ba? Saan ba nanggaling itong COX-2 na ito? Okay, diba sabi natin, pain is coming from your prostaglandin caused by arachidonic acid by means of your cyclooxygenase pathway. Diba? Sa cyclooxygenase pathway, okay, nai-inhibit natin yung ating prostaglandin E2. Ano ba yung significance ng prostaglandin E2? Your prostaglandin E2 is very important in, okay, in your maintenance or in the protection of what? Of the gastric mucosa. So therefore, itong COX na ito, kapag binigyan mo ng NSAID, pwede po natin magkaroon tayo ng gastric irritation. That is why, ang pain ng pasyente na may osteoarthritis is chronic. So that is why, kapag chronic ang pain, hindi tayo pwedeng gumamit ng chronic NSAID use because of the risk of peptic ulcer disease. So that is the main reason why we have to give your COX-2 inhibitor. Example is your celecoxib, diba? And that COX-2 inhibitor will prevent the patient to suffer from peptic ulcer disease as a complication of prolonged NSAIDs use. Alright. Next one. Topical analgesics can be provided. Pag sinabi nating topical, ipinapahid po ito into the joints. Ano lamang ang dapat nating tandaan? Do not apply your warm or your hot compress together with your topical analgesic. Why? Because it may cause burn. So tandaan, you have to monitor for redness on the area and do not apply, okay? Or do not have your warm or your hot compress together with your topical analgesic because of the increased risk of burn. Supplements. What are the supplements that could be provided to the patient? Pwede itong mga supplements na ito. You have your glucosamine and chondroitin. Para saan ang supplements na ito? Your glucosamine and chondroitin will maintain a healthy joint. Okay? It maintain a healthy joints to prevent the destruction of the joint, to prevent your formation of your osteophytes or your spurs. Alright. Another treatment, viscose supplementation. Pag sinabi naman po nating viscose supplementation, it is intra-articular injection. What do you mean by intra-articular injection? It is a parenteral administration wherein it involves injection of hyaluronic acid within the joint. Okay, ano yung action ng hyaluronic acid? That hyaluronic acid could have an anti-inflammatory action. And that anti-inflammatory action can result into absence of swelling and pain. Right? Not only intra-articular injection of hyaluronic acid, we could also provide intra-articular injection of corticosteroids. Ano nga ang effect ng corticosteroids? Corticosteroids is an anti-inflammatory drug. So therefore, it reduces the swelling, thus it reduces the patient's pain. How about your surgical management? Surgical management po natin is joint arthroplasty. If the affected area is the hip, we call it as your hip arthroplasty. If the affected area is the knee, you have to give your knee arthroplasty. Now, for the post-op care of the patient, what you have to monitor is the drainage. Okay, tandaan, kapag joint and hip arthroplasty, monitor for bleeding. Okay, so you check the drainage. Normally, okay, mataas ang ating drainage, mataas ang ating collection of blood for the first 24 hours post-op. Okay? So for the first 24 hours, madami kang makokollect na blood, but it should not be persistent. Now, you need also to teach the client on immobilization post-operative. Bakit kailangan nating i-immobilize? That is to promote healing. So, immobilize the affected area, the joint area should be immobilized so that it would promote healing. Okay. For your hip arthroplasty, tandaan that the patient's position should be abducted. Okay, what do you mean by abducted? Pag sinabi nating abducted, we need to provide pillows or a wedge abductor so that to prevent rotation or internal rotation of the hip. Okay, so kailangan nagkaroon tayo ng proper placement of the femur to the acetabulum. So tandaan, the patient's position, pag hip arthroplasty, should be maintained on abducted position. So you have to apply your abductor or wedge abductor or your pillows in between the patient's between the patient's thigh. And in addition, kapag yan ay hip arthroplasty, we need to teach the client to avoid bending, okay? To avoid increasing the angle of the head of the bed more than 60 degrees. Why? Because it may result into dislocation and subluxation of the joint. Right? So, yun yung tinatawag po nating mga medical surgical management. How about your nursing management? Nursing management natin, sabi natin, pain as your priority. So what you have to provide is hot or warm shower, hot compress, warm shower. It will also relieve the stiffness before any activity. Alright, what else? Sabi natin, the risk factor is obesity. Nagkakaroon tayo ng stress sa joint. So therefore, anong ating nursing management? You teach the client to lose weight to prevent stress on the joint. Okay. Immobilization or rest of the joint is very important. Why? Naalala niyo po ba kung anong karakteristik ng pain ng osteoarthritis? In osteoarthritis, the pain is during exertion or activity while it is highly relieved by rest. So that is why joint rest is necessary. And of course, avoidance of joint overuse. So therefore, we are going to lessen your weight-bearing activities of the affected joints. So therefore, ang ating exercise that is most suitable for the patient are those exercises that will not put stress on the joints of the patient. At anong exercise ang hindi magpe-place ng stress sa joints? So, bawal ang jogging, bawal ang running. The best exercise would be swimming. Ano po? So, isometric, postural, and aerobic exercise such as swimming as a best exercise for the patient because this exercise will not put stress onto the patient's joints. Right? So they are your nursing management for a patient with osteoarthritis. Alright. Let us compare the last type of arthritis. Okay, so we are done with gouty and osteoarthritis. Now let us compare your rheumatoid arthritis. Okay, pag sinabi nating rheumatoid arthritis, usually class, the most common population that is involved is your females. Elderly females. Okay. Anong pinagkaiba po nito kay osteoarthritis? Diba si osteoarthritis would only be unilateral and localized. This type of arthritis is common in females. This is bilateral in nature. Diba? Pag sinabing bilateral, kung ano yung meron sa kanan, meron din sa kaliwa. This is also systemic. So, buong katawan is also affected, okay? And at the same time, tandaan po natin that rheumatoid arthritis, okay, is unilateral, this is systemic, and it may involve also the non-weight-bearing joints. So, kasama dyan ang fingers. Alright. Now, sabi natin, the main cause is autoimmune. Naalala, autoimmune. So when we talk about your immune system hypersensitivity reaction, that is your hypersensitivity reaction type 3. Okay? So this is your hypersensitivity reaction type 3 wherein nagkakaroon tayo ng building of immune complex o itong yung immune complex, ito yung tinatawag nating antigen-antibody complex. What are the populations involved? Sabi ba natin? Elderly, women. That makes it different from osteoarthritis. And of course, this is also having your familial tendency. Alright, so tandaan, diniscuss po natin, it is symmetrical and bilateral. Kung ano ang meron sa kanan, meron din sa kaliwa. What else? Aside from that, non-weight-bearing joints could also be affected. Okay? So kasama ang fingers, weight-bearing joints possible, but it is usually unilateral. And of course, it is now systemic. So, the immune complex could also be dislodged into the patient's blood. Alright. Now, what happens in a patient with rheumatoid arthritis? Sabi natin, hypersensitivity type 3. Immune complexes formed by antibodies. You have the IgA and the IgM develop against your what? Against your antigen. Okay. So therefore, kapag meron kang antibodies, it will be dislodged into the synovium. So ano mangyayari po? Ano ba yung synovium? The synovium is the area. Okay, it's the area where the synovial fluid is produced within the joints. So therefore, inflammation will occur. Naalala ba ang inflammation? Di ba sabi natin, kapag merong inflammation, there would be swelling. Whenever there is swelling, there would be pain. Kapag may pain po tayo, next to pain would be loss of function. So, possible problem na naman natin, the patient will not be able to move. The patient will not be able to use the affected area, so you will have your stiffness. Diba? So, kasama din ng stiffness. What else aside from that? Redness and warmth of the area will be there. Okay, so yung pagkakaiba po nila is more of the affectation. Again, tatandaan, pag yan ay rheumatoid, it is bilateral, symmetrical, systemic. It may involve non-weight-bearing and weight-bearing joints. Alright, now, what happens after inflammation? That inflammation will result into what? Into the proliferation of neutrophils and other cells in the synovium that causes accumulation of fluids, destruction of the joint in which you will have your pannus formation. O, ano bang itsura nitong pannus formation? Alright, pannus formation. Okay, when we talk about your pannus formation, ito yung ating joint, right? So, in this, the problem is inflammation. Okay? And that inflammation will result into pannus formation. Ano yung pannus formation? Nagkakaroon ng mga erosion. Okay? So, therefore, kung ito yung normal na joint natin, nagiging eroded na yan. Okay. Now, kapag may erosion sa joint, anong mangyayari? The cartilage will be destroyed. And once that the cartilage is destroyed, not only the cartilage, but the bones are also destroyed. So, pag na-damage din po ang ating bones, ano ang pwedeng mangyari? Calcifications will occur. Okay? Pag sinabi natin calcification, destruction of the bony structure. That is why, that is the reason kung bakit tayo nagkakaroon ng fractures and osteoporosis as the result of our tinatawag na rheumatoid arthritis. Okay? So, yun ang pagkakaiba niya. Tandaan, pag rheumatoid, pannus formation. Okay? Kapag yan ay gouty arthritis, tandaan, it should be tophi formation or enlargement of the joint. So, sa kanya, you have your pannus formation, nagkakaroon tayo ng calcification and degeneration of the cartilage and the joints. Alright, now, what are the clinical manifestations of inflammation? Okay, so tandaan, pain, aggravated by movement. Tandaan, this is the most common manifestation in established rheumatoid arthritis. Okay? Aggravated by movement. Naalala ba? Di ba sabi ko, pag may inflammation, may swelling. Kapag may swelling, merong pain. Kapag may pain, may loss of function. Kaya nga, the pain is aggravated or pain experience is usually occurring during movement. Alright, what else? Tandaan, sabi natin, it's bilateral, it is symmetrical, and the affectation is systemic. So, buong katawan. So, therefore, kung systemic ang manifestation, so you have your fatigue, weakness, anorexia, weight loss. Tandaan ha, kapag osteoarthritis, obese, mataba ang pasyente. Pag rheumatoid arthritis, because of your antigen-antibody complex, pumapayat sila, caused by anorexia. So you have your weight loss because of its systemic effect. Alright, what are the late manifestations? Late manifestations are the following. Morning stiffness may occur. Okay? So, bakit meron tayong morning stiffness or gel phenomenon? Because of pain. Pag may pain siya, hindi niya igagalaw, di ba? Because the pain is usually during movement. So, in the absence of movement, it will result into stiffness. Soft joints. O, bakit nga naging soft joints? Because of the pannus formation that result into the degeneration. It results into calcification. Okay? So, soft joints will be observed. Spindle-like fingers. Subluxation of the cervical spine as a complication. Kaya tayo nagkakaroon ng tinatawag nating osteoporosis. Alright. Next one. So these are your manifestations. You also have what we call your joint manifestations. Ano po? Ano yung ating mga joint manifestations? Right? So, joint manifestations are the following. So, you have your bottom-ear deformity. Nasaan dito yung bottom-ear deformity? Okay. Bottom-ear deformity. Okay. Ito yung deformity sa pasyenteng may rheumatoid arthritis. Swan neck. Okay. So, this is your swan neck. What else? Ulnar deviation. So, this is your bottom-ear deformity. This is your swan neck. Okay. You also have your ulnar deviation. Ito yung makikita natin. Okay, presence of cyst, tawag natin is Baker cyst. Dahil because of the deformities that will occur, you will have your carpal tunnel syndrome. Now, ano yung carpal tunnel syndrome? In carpal tunnel syndrome, nagkakaroon tayo ng tingling sensation, paresthesia, and numbness of the affected area. Now, how are we going to assess carpal tunnel syndrome? Meron tayong dalawang assessment dyan. Ano yung dalawang assessment? Tawag natin positive Tinel sign and positive Fallen sign. Ano yung positive Tinel sign? Sa positive Tinel sign, you need to tap the median nerve, and when you tap the median nerve using your percussion hammer, it produces a shock-like manifestation. Okay? Tandaan ha, ulitin ko. Pag carpal tunnel syndrome, para malaman na carpal tunnel yan, kailangan positive Tinel sign. Ano nga yung positive Tinel sign? You tap the median nerve and it will create a shock-like manifestation. How about your positive Fallen sign? In positive Fallen signs, you need to flex the wrist area, and during flexion of the wrist area, it could result into what? It results into shock-like manifestation. So tandaan, para ma-assess ang carpal tunnel syndrome sa pasyenteng may rheumatoid arthritis, positive Tinel sign and positive Fallen sign. Paano i-assess ang positive Tinel sign? Tapping of the median nerve that causes shock-like manifestation. Paano i-assess naman ang positive Fallen sign? Positive Fallen sign is you need to flex the wrist, and flexion of the wrist will produce a shock-like manifestation. Alright. What else? How about your systemic manifestations of rheumatoid arthritis? Ano naman? Pag buong katawan ay affected, when the antigen-antibody complex or your immune complexes are lodging into the blood, it creates subcutaneous nodules. Okay? So, saan mo makikita ang subcutaneous nodule? Tandaan, it is painless nodule. It is round and movable. Painless po ito, which is all occurring on the ulnar surface of the arm. Naalala si Baker cyst? Okay, that is one of the characteristic of the Baker cyst. What else? Inflammation of the other connective tissues would be involved. Kasi sabi natin, it is systemic in nature. So, yung ating joint is a connective tissues. Therefore, other connective tissues into the body are also affected. That is why arteries or blood vessels will also have inflammation. Ang tawag natin, pag blood vessels, vasculitis. Okay, so possible vasculitis as a systemic manifestation. What else? Ischemic lesions that occurs as a small brownish spots. Okay? What else? Aside from that, you also have what we call your peripheral neuropathy. Okay? Neuropathy will also occur. Kaya nga nagkakaroon tayo ng numbness, pleurisy, pneumonitis, and pulmonary hypertension. So therefore, connective tissue din po ang ating pleura. So if there is destruction of the connective tissue such as the joint, the pleura, the pericardium will be also involved. So therefore, heart and the patient's lungs will also be affected. Right? So they are what we call systemic manifestations. So tandaan, ang pinagkaiba po ulit, I will be emphasizing ng rheumatoid arthritis, it is usually bilateral, symmetrical, systemic. It may involve what? It may involve your fingers, non-weight bearing, and your weight bearing as well. Alright? And usually this is autoimmune. Now, how are we going to manage? Okay, so management na po tayo. So medical management for rheumatoid arthritis, you have your aspirin. Okay, ano ba yung aspirin? Aspirin is an NSAIDs, di ba? Acetyl salicylic acid. But take note, ang side effect, chronic use of aspirin, again, it causes bleeding. So you have to monitor the bleeding time. Okay, what else? Aside from that, aspirin, chronic use, kasi ang rheumatoid is a chronic condition, may also cause ototoxicity. Anong ibig sabihin ng ototoxicity? It may cause hearing problem, hearing loss. NSAIDs, non-steroidal anti-inflammatory drugs. Example is your acetaminophen, indomethacin, diba? So they are your NSAIDs. Naproxen sodium. In the use of NSAIDs, tandaan po natin, be sure that you have to take it with meals. Bakit with meals nga ulit? Because of the potential side effect of gastric ulceration. Okay, you have also what we call your DMARDs. Ano naman ang ibig sabihin ng DMARDs? DMARD stands for disease modifying anti-rheumatic drugs. Disease-modifying anti-rheumatic drugs. Tandaan, it will not cure the disease, it will not cure the rheumatoid arthritis, but it will only what? Slow down the process of the disease and will produce remission. Ano nga ang ibig sabihin ng remission? Pag sinabi nating remission, absence of clinical manifestation. So therefore, ang ginagawa po ng DMARDs is only of palliative relief. Ano nga ang ibig sabihin ng palliative relief? It is only to relieve the clinical manifestation. But usually, it will not relieve the, it will not cure the disease itself. Now, what are the examples of these DMARDs? You have your anti-malarial, Example is your chloroquine. Bakit kasama yung anti-malarial? Kasi ang anti-malarial would have a property of what? Of a property of modifying the immune complexes. It may destroy the immune complexes. But however, tandaan, yung chloroquine po natin may cause blurring of vision. So one of the side effect is visual problem. So therefore, eye exam every 3 to 6 months is indicated. Another one is your penicillamine. So they are the drugs that may slow down the disease process and it may produce remission. Another drugs. Next slide, please. You have your cytotoxic medication. What do you mean by cytotoxic? Cyto means cell, toxic means destruction. Destruction of the cell. Bakit bibigyan ng cytotoxic drugs? Kasi ang pinaka-cause natin, class, is autoimmune. Diba? Pag sinabing autoimmune, self-destruction. So, anong papahinain ng cytotoxic drugs? It will weaken the immune system. So, it will suppress the immune system that is causing your what? Causing the destruction of the joint. So, one of the mainstay of treatment is methotrexate. Methotrexate is a chemotherapeutic drug and at the same time, it reduces your what? Nire-reduce niya po yung inflammatory mediators. However, tandaan po natin, methotrexate is a chemotherapeutic drug that may kill not only yung ating mga healthy cells, healthy cells are also involved. So, when the healthy cells are involved, what may happen? WBCs may be reduced. So, ano po ang ating possible complication? It may cause your leukopenia. Mababa ang WBC. Ano nga ang WBC nating normal? The normal is 5,000 to 10,000. So kung ang methotrexate ay nakakapagpababa ng WBC, ano ang ating problem? The problem is immunosuppression, thus the patient could be at risk for infection. So cytotoxic, pag sinabing cytotoxic, chemotherapeutic drug. And of course, you have your immunosuppressants. Cyclophosphamide, cyclosporin, azathioprine, they are your immunosuppressants. Ano class ang ginagawa ng immunosuppressants? Pag sinabi po nating immunosuppressants, pinapababa niya ang immune system. So therefore, to prevent your autoimmune reaction. So therefore, ano na naman ang mangyayari? Immunosuppression. What again would be your nursing diagnosis? Risk for infection. So therefore, in a patient taking cyclophosphamide and azathioprine as immunosuppressant, you have to monitor the level of WBC to determine if there is leukopenia. Check if the patient has fever and sore throat. Why? Because fever and sore throat is an early indicator of infection. Alright, other treatment, gold salts. Kapag nakita mo gold salts, it is only prescribed in patients with rheumatoid. Hindi ito binibigay sa gouty, hindi binibigay ito sa osteoarthritis. It is only being given to a patient with rheumatoid arthritis. Example is your gold sodium thiomalate. Okay, ano ang reaction nito? Your gold sodium thiomalate reduces pain and inflammation. So, ang ginagawa niya, this is also an anti-inflammatory. So, pag nakita mo yung gold salts, para kanino ibinibigay, it is only being given in a patient with rheumatoid arthritis. And of course, there is inflammation. So, that is the main reason why you have to give your corticosteroids. So, what are the examples of corticosteroids? Example is a subcutaneous administration of etanercept. Okay, etanercept. Ano ang ating action ng corticosteroid? It binds the tumor necrosis factor and it blocks its effect. So therefore, ano ba ang ginagawa ng tumor necrosis factor? It is for the destruction of what? Of destruction ng joint. So therefore, kapag nawala ang tumor necrosis factor, na-block natin ang effect nito, mawawala ang destruction ng ating cartilage. At pag nawala ang destruction ng cartilage, mawawali din ang signs of inflammation. So tandaan, tumor necrosis factor is always involved in inflammation. So we block the tumor necrosis factor so that inflammation will also be reduced. Thus, pain will also be relieved. Alright. And of course, you have also the following collaborative management. Kasama din dyan ang isa pang steroids. You have your infliximab. Anong ginagawa niya? Again, the target is your tumor necrosis factor. Diniscuss natin that the tumor necrosis factor is involved in inflammation. So, it is given IV, single IV infusion in several hours to neutralize the activity of the tumor necrosis factor to prevent inflammation. So, ang ating key dito is to what? To reduce the inflammation. So, those are the drugs that can reduce inflammation. Diba? Naalala, binibigyan natin sila ng cytotoxic drugs, binibigyan sila ng immunosuppressants, binibigyan sila ng corticosteroids, okay? And also binibigyan sila ng DMARDs, okay? And NSAIDs. Alright. Now, nursing management are the following. So, for pain, rest is important and proper positioning. Good body alignment. So, rest would relieve the inflammation and pain. Okay. Ice and heat. So, tandaan natin, ito yung tinatawag nating thermotherapy. In thermotherapy, it is the alternate, okay, application of cold and heat application. Pag sinabi nating ice application or cold, it should not be more than 15 minutes. Kailangan po, yung ice application po natin should only be less than 15 minutes. That would relieve the pain before any activity. How about your heat? After cold application, heat therapy will produce what? Vasodilation. And that vasodilation will relieve the swelling. Tandaan, yung ice natin as a form of analgesia to prevent pain. Heat natin to prevent swelling. That's why to prevent pain as well. And of course, a patient with rheumatoid arthritis may have deformities. Diba? Naalala ang mga deformities? Baker cyst, boutonniere deformity, swan neck, ulnar deviation. So, anong problem natin? Disturbed body image. So, therefore, you have to enhance the patient's body image by communication, helping them on acceptance of the disabilities. Okay, teach about coping mechanism, enhanced coping mechanism, and of course, you need to provide emotional support. Right? So they are your nursing interventions and the comparisons of 3 types of arthritis: gouty, osteo, and rheumatoid arthritis. Alright, let's move on with our last topic, and that is pertaining to oncology or cancer development. Now, let's talk about your cancer development or neoplasia, right? Pag sinabi po nating cancer, neoplasm or neoplasia, it is an abnormal, disorderly proliferation of cells. Okay, so abnormal, disorderly proliferation of cell. Mabilis dumami, mabilis kumalat. Tandaan po natin that one of the characteristic of a healthy cell, it should have limited cellular division. Okay, pag sinabi nating cellular division, we are talking about mitosis. Nagkakaroon lamang tayo ng mitosis or ng cellular division wherein when it is used only to repair tissues, and you are going to what? You are going to repair and to replace tissues. O, doon lamang tayo na dapat nagkakaroon ng mitosis. However, in the patients with cancer, ang mitosis niya would be fast. So, usually, nagkakaroon tayo ng tinatawag po nating abnormal disorderly proliferation of cells. That is why mabilis dumami, mabilis kumalat ang cancer cells. So, that is about neoplasia and neoplasm. Now, how does neoplasm and neoplasia occur? Next slide, please. Okay. Let's talk about your pathophysiology, no? So, una, nagkakaroon tayo ng genetic mutation of the cells. When it is having your genetic mutation, nagkakaroon tayo ng abnormal proliferation na yung tinatawag nating cell division or mitosis. And after which, that abnormal cell na nag-proliferate, dumami, will cause invasion and infiltration. What do you mean by invasion and infiltration? It penetrates and it is able to what? It is able to invade different organs in the body, not only the organs, but the lymph and the blood. That is why it is causing metastasis. Right. Now, before that, we need to classify your cellular aberration or neoplasia. We have 2 major classification. Ano po? So, a neoplasia could be what? Could be benign or malignant. Okay. It could be benign or malignant. Ano nga ang difference ng benign and malignant? Alright. When we talk about benign, okay, tandaan po natin, iba ito sa malignancies. Yung cancer na tinatawag natin, yun yung malignancies. Okay, let's talk about their characteristic. Next slide, please. Alright. First, you have what we call your cell. Okay, so kung mapapansin nyo, if it's benign, the cell is well differentiated. While when it is malignant, it is undifferentiated. Pag sinabing undifferentiated, walang function. We cannot differentiate what type of cell it is. Alright? So that is the main characteristics. Again, benign is well differentiated, malignant is undifferentiated. Growth pattern. Okay, pag sinabi natin the mode of growth of benign, it is usually through expansion. Okay, lumalaki. Okay? Pag sinabi nating malignant, it grows at the periphery and infiltrates. Anong ibig sabihin ng periphery? Dumadami dun sa kanyang end of the cells. What else? Aside from it grows at the periphery, it causes infiltration. Pag benign yan, example is your cyst. Nakabalot siya sa capsule. So, ang tawag natin doon, it is encapsulated. Ano po? Pero pag sinabi po natin na yan ay malignant, okay, it infiltrates. It is able to invade. It has the ability to penetrate the different organs in the body. Alright, growth rate. Okay, gaano kabilis? Benign, it is usually slow growing. Malignant, usually it is fast. Mabilis ang pagdami. How about your metastasis? Metastasis, what do you mean by metastasis? It is the extension to distant organs. It is the spread to distant organs. So kung mako-compare natin, yung benign does not have any metastasis. Bakit hindi siya kumakalat? Kasi nga, encapsulated siya. Diba? Naalala yon? Alright. How about your malignant? Pag malignant or cancer, there is metastasis. Paano nagkakaroon ng metastasis? It is via lymph and via the blood. Okay? Sumasama ito in the blood and in the lymph circulation. Alright. Now, what about the effects of benign and malignant malignant neoplasm. If it's benign, the effect is only localized. Okay, say for example, myoma. Okay, in myoma, that is a benign growth of cyst that could be found on the uterus. So it is only found on the uterus. It is only localized in nature. How about if it's malignant? Pag malignant, it is generalized and systemic. Not only, say for example, breast cancer. If it's breast cancer, it does not only be limited into the breast tissue, but it will grow, it will be extended, not only to the breast, but it will also include the lungs, the liver, diba, and other distant organs in the body. So the effects are generalized and systemic for cancer. For tissue destruction, benign, it has no tissue destruction. Usually, nagkakaroon lamang tayo ng tissue destruction if there is impairment of the blood flow. Say for example, whenever you have your myoma, di ba, lumalaki siya ng lumalaki. Pag lumalaki ng lumalaki yung myoma, it causes compression, di ba, of the vital organs. Whereas, whenever there is your malignant, it causes extensive tissue damage. Why? Nagkakaroon tayo ng infiltration of the organ that causes organ failure. And of course, when we talk about ability to cause death, benign usually does not cause death. It only causes death when it involves the vital organ. How about your malignant? Always and usually causes death. So as a review, what is the cell for benign and malignant? For benign, well differentiated. For malignant, it is undifferentiated.